Okay, I'm Josh Nichols, the founder and CEO of CrossBraining. I know that a lot of my fellow educators right now are trying to figure out how to do hands-on learning remotely. So we wanted to share a success story and insight from someone who pulled it off. Just so everyone's aware, by request, we are recording this webinar and it will be posted on our YouTube channel. We're scheduled for an hour, but I know that any minute we can give back to you is precious, so we will not hold you for any longer than is necessary. We'll start with Dr. Spencer talking about how she used video learning and assessment in her classroom during Michigan's first lockdown in the spring. She will share some lessons learned and best practices that we hope all of you will think is useful. We will leave plenty of time for Q&A. If you have any questions, please type them in the Zoom's QA along with your name and where you're from, and we'll get them asked. Kristin's bio. Dr. Kristin Spencer is an allied health program director at Jackson College here in Michigan. In 2018, she was honored as one of our area's healthcare angels and received the Outstanding Faculty Award at Jackson College in 2016. She has been in higher education as a program director and professor for over 16 years, with extensive experience in curriculum development and assessment. I'd like to introduce Dr. Kristin Spencer. Thank you, Dr. Spencer, for being with us today.
Thank you so much, Josh, and welcome everyone, and thank you for joining us this afternoon. So just to give you a little bit of my background, as Josh said, I have a PhD in higher education. My healthcare background is in medical assisting, and I am currently the program director of the medical assistant program at Jackson College. So I just wanted to share with you what we did and had to do when COVID hit our area and we had to go completely online. So when we first found out that there was essentially a potential that we were going to have to go online, Dr. Phelan, our president at Jackson College, made the decision to extend our spring break. This was back in March. So we were just finishing up spring break and we were supposed to start our second half of the semester, and it was extended, and he gave everyone 1 week to put all of our classes online. So obviously with the health science courses, we had labs, they had to be done. So we had to figure out very quickly an effective way to be able to still allow the students the opportunity to practice and gain those skills while also being able to assess them, since at that point in March, we had no idea when we would be returning back to the labs. So as I said, we had 1 week to convert everything, and we're going to be continuing this. Dr. Phelan had decided to keep us online through fall of 2021, just to ensure that we didn't have to do all of this again, essentially, because if anyone's having to do this, you know how much work it takes. So it was much better and much more proactive for him to say, we're going to continue doing it this way. So we were all well prepared for that and continue to be. So we are continuing to be online with the exception of critical labs, so labs that absolutely cannot be done remotely. So I just want to share a little bit about how we went about that and were able to make it work and be effective. So when this first happened, I, in my program, had both new and current students. So I had students that were just starting their clinical lab courses, and I had current students who had done about half of their courses, and then all of a sudden, we had to move everything online. So as I'd mentioned, we had 1 week to do this. So with the help of my adjuncts, what we did is we created what I call go bags with supplies. So we had anything that they had to do in those courses that were things that they could do that were not invasive procedures. So of course, no needles, nothing with chemicals or anything like that were sent home. But we were able to send home materials for setting up sterile fields, bandaging, first aid, personal protective equipment, pretty much anything that we could think of that would be safe. So what we did, because the fact that usually in our labs, we demonstrate the skill, the students practice, they continue to practice, and then they get that assessed on that skill. And of course, so many of our students in allied health and nursing are visual learners. So what we did is we developed instructional videos ourselves. So I had a video of myself doing setting up a sterile field, a video of myself performing wound care, and things like that. So I wanted to give those students an opportunity to see what the procedure was before they had to perform it themselves. Because again, we did have to assess it online as well. So I've used some videos in the past, and I know often, especially in nursing sim labs, video assessment is often done. Usually it's scheduled times and all of that. But this, of course, we had to just do remotely. So students were doing it in their living room, in their kitchen, wherever they could do. So what was nice about this, though, is that the students were practicing and recording and doing all of this, and they were able to self-assess. So instead of us just standing and watching them perform it, they could self-assess first and then send that to us. So we were able to use these videos for both formative and summative assessment. And of course, as I mentioned here, with using video assessment, it's unlimited practice time. So even though right now, well, come January, when we get back into the labs, we are very limited on the number of students that we can have. So students may not get as much one-on-one time with the instructor or the equipment or whatever it may be. So what's nice about the remote assessment is the fact that they can just continue to practice, record, and self-assess before sending that video to us. And if you've ever assessed students in a lab, you know the anxiety that they have when we're standing and we're watching them, and they're trying to perform the skill. And what we saw by doing this is that not only did the students become more confident in their skills, but they became much more proficient in performing them. It was amazing for us to see the change in our students. And even when we were able to get back in lab part-time, and when we revisited those skills, the students were very comfortable with them because they had made the mistakes at home in a safe environment where they didn't feel that they were being put on the spot or worried about what we might say as the instructor. One thing too is, often when they're in the labs and they're performing the skills, we have to kind of walk them through those steps and do a lot of hand holding as they're doing that. And, so this way they just kind of had to jump in and do it. And they had to perform those skills, again, strengthening that confidence. So what we did have to do, though, even though in years of doing this, we would often send students home with supplies and things to practice the skills at home. And then, of course, they would come back for the day of their check off, their competency, and they would bring back those supplies unopened. So as we all know in higher education is that students don't do optional. So these were graded assignments and assessments. And we were able to use these to meet accreditation standards as well. So the way that we designed this is we used our actual skills checklist. So as I had mentioned, even when we got back into lab, students were able to continue to perform those skills. And so we used a flipped classroom model. So we would always, and we still do this now, we provide the students with the content, with the didactic material, and then they apply those skills. So when they were doing these videos from home, as I mentioned, they were able to self-assess, and then they would submit a finished product. By doing that, it saved we as the instructors immense amounts of time. Instead of having one student in a bay being evaluated by this instructor and one student in another bay being evaluated, we were able to, with video, students would submit it and I could evaluate them on a Sunday afternoon if I had the time. So it was more, it worked well for their schedule and my schedule. The other thing too is with the videos that they produced, they were able to provide an opportunity for explanation and reflection. So the way that we used the videos wasn't the students performing a skill, it was them teaching a skill. And as we know, the best way to learn is to teach. So it was great to see those students not only mastering that skill, but also the knowledge, really having a deeper understanding of not only what they were doing, but why they were doing it. So they were able to give that explanation and provide more of a teaching tool performing that skill. So what we learned from doing this is one, the first thing is that remote assessment does work. And I know when this first happened, and anyone who's just now getting into this area of having to figure out how to put things online, there was confusion, there was fear, there was chaos, essentially. We had, again, 1 week to kind of figure things out. And since then, we've improved things as we've gone on as well. But in the mindset of health science, we always think that the only way students can learn these skills is to be in our lab and perform these skills and have us assess them and have us tell them what they're doing wrong. And what we found is that the students that were performing these skills at home came to their externship or their clinical time and seemed as much, if not better, prepared than our students who were only in the lab. So the other thing is too, is even if you do have some lab time, so for example, we're allowed right now to have 4 students in lab at a time. So of course they have to socially distance. So we have 2 students in one area, 2 in another, an instructor with each. And so again, when you're limited to the space, it's really hard to get all of those skills in. So by doing video assessment, we're able to, again, with those non-invasive skills, have them do those at home. And even if there's certain things that they need equipment for, we can still have a different area in the lab where they don't have to have an instructor. So for example, one of the skills we do is preparing an oral medication. So obviously an instructor doesn't have to be watching the student for safety concerns. So they can go into a different area, they can perform that skill and record it, and then the instructor can view that later. So this way we can actually allow students to get more one-on-one time with the invasive skills. One thing that was really great about this is I did present this to MAERB, which is the accrediting body through KHEP for medical assisting, and provided the information to the executive director. And she thought it was great and approved it to meet our accreditation psychomotor outcomes. So because of the fact that we could actually view the student and assess it, we were able to get those students checked off on those skills. The other thing too is, especially in our field of medical assisting, our students do a lot of patient education. And again, patient education is really just teaching to someone else. And we found that with them doing this, again, because of the fact that they're giving an explanation and doing kind of a teaching, then they're actually developing those skills as well. So that was a huge benefit as well. So again, once we were able to get back in lab, which wasn't until July. So again, I had one group of students who had just started the MA program and had not been in lab whatsoever. When they came in July, they were pretty confident. They had been doing a lot of skills already. And then my other students who had been displaced because of COVID, they only had to come back in and do phlebotomy skills for labs. So that was the only thing that they had left to do. So we were able to focus on that, get them out into their clinical. And my students who had just started the program in winter semester should have been done this month. And because of us doing this work, they're still going to be done this month, which is amazing to me. We didn't have to delay any of their learning because of this. So what we've continued to do, as I mentioned, is for this fall, we're doing a hybrid distance learning. And because of how effective this has been, I've actually put plans in place to continue this method. Even if we get back to so-called normal, where we can have students in lab as we normally would. The flipped classroom with the hybrid format has been working beautifully. And so even for this semester, I've provided supplies for the students and even for our winter semester. So again, we have plans in place because we are going to be able to have students in for critical labs. So we'll be able to focus on invasive things such as injections, phlebotomy, things that require equipment like EKGs, and everything else they will be able to do remotely. So again, what's nice about this is they are responsible for practicing and getting those skills done, and just really getting those skills where they need to be to go out into the clinical field. So for winter, what has actually come of this is in my clinical courses, I have 4 clinical courses with my medical assistant students. And because of us being able to do the remote assessment, I have 1 course where they are able to do all of their lab skills remotely. So we won't even have to have them come to lab for that class, which is going to allow them to spend other time on the other skills that they need that we can't do at home. So after we did this, I did want to get some feedback from the students. And some of the feedback that I got was that students had less anxiety. As I mentioned, even they had said, that it was nice because I wasn't standing staring at them or watching them do the skill. And the fact that they were able to catch their own mistakes. We were actually doing this with the recording and using CrossBraining before COVID hit. So we had students performing injections. So if you've ever taught something like injections or even phlebotomy, when a student's doing the skill, if they're doing something that we consider incorrect, like just incorrect technique, but nothing that could cause the patient harm, we don't necessarily want to stop them because we don't want to increase that anxiety. So we'll let them finish and then mention, you may not have noticed, but you moved your hand a certain way. So be careful with that, or make sure that, when you safety the needle, that your arm is over here. So of course, when we tell students that, because of their anxiety and us standing watching, they usually have no idea what we're talking about. So they I don't remember doing that, but I'll try to remember in the future. Once we started having students recording themselves and doing this, they were finding those mistakes. So they were now seeing that. And even though, of course, with injections, we had to be there because of the fact that they were injecting each other, they were the ones now that were performing that self-assessment. And the self-assessment was what made a huge impact on their ability. The other thing too, especially with injections, the students said that they were able to become faster. So again, with injections, especially new students, they'll overthink, they go too slow, that can cause discomfort for the patient. And with this video method, they have a time limit. So with this time limit, they were actually able to get their time to an appropriate time, because as we know, in the field, you have to be fairly quick in performing these skills. The students had also, had mentioned that it was a great tool for visual learners, and it really hits all areas of learning, because students in this, and I'll talk about in a second, the students take video, but then they're actually narrating their videos. So where you could just take a video for TikTok and have song or background noise or whatever, with this, they're actually able to take the video, it then removes any background noise, and then they're performing a narration or creating a narration that they would be doing. So just to give kind of an idea of how this works. So we've been using CrossBraining for just over a year now. And one thing that is unique to this, as I mentioned, a couple things. With their videos, the videos are limited to 45 seconds. Now, when I first learned about this, I'm like, well, there's no way that we can do things in 45 seconds. Things take so much longer than that. And what I found is when I broke things down into separate lessons, it was very effective. And as I mentioned, especially with injections, we were able to get students speed up. So we wouldn't have them record from beginning getting the medication to end thanking the patient for their time. We would have them do a video on withdrawing medication from the vial, preparing the medication. And then we would have them do a video on giving the injection. And so that 45 seconds was a huge help to us and a huge help to the students, because it really helped them not only speed up their skills, but they really became more confident in the fact that they could. So to give an idea, this is an example of one of the lessons that I've done. And I've got a number of them now. I just keep making more. And I will say that for me to make a lesson on my end, it takes probably 5 minutes, if that. It's very quick. And what's nice is with the summary, you can do something simple. So I just have demonstrate how to properly don PPE. Or if you have a whole, assignment skills checklist, you could embed that right into that as well. I just keep it simple for my students. You would then break down the steps. So what I did for them is step 1, don gown. Step 2, apply the mask and goggles. Step 3, don gloves. And then you can choose to add reflection questions. So again, what's nice about this is I'm actually able to hit some of those other standards required for accreditation, things that students should be able to answer in relation to that skill. So for example, I have one for hand washing, and one of my reflection questions is, why do we use a dry paper towel to turn off the faucet? So it gets them thinking about those things. This past week, I actually had the students doing blood pressure. Now, of course, I can't assess whether they're hearing that. So that is something that we would need to do in a face-to-face lab. But I'm able to, through this, make sure that they're doing the right technique, that they're performing the steps properly. And what I tell them when they're doing this is that this is where the narration comes in. So say with hand washing, we have 45 seconds of video, but maybe with all of the steps, it's going to take longer than 45 seconds. So what I tell the students is in that narration, that's when you state, wash your hands for 20 seconds. So they would address all of those things during their narration. And again, as I mentioned, what's really nice is the students take the video, it scrubs the background, they upload it. So I'll show you on their side, this is what it looks like. So they can capture it with their phone, and this actually works great on the phone as well. So they can capture it directly. They can use their computer, and they can also do screen capture. So, which is really cool if you're wanting to have them demonstrate entering something into an electronic health record, then they can do a screen capture of that and narrate that. Once they have their video, then they would do their narration. And with that, it actually gives them the opportunity to type a script so they can really think about what they're saying, and they can redo it. So I just had a couple students on their respirations and pulse CrossBraining, and they had misspoke some things, said some things wrong in their narration. So they didn't have to go back and redo the whole video. The video was great. So all they had to do was go back and fix the narration. So that was a great thing for them in a quick fix. The other thing is the reflect. So if there is a reflection question or questions, then you can put those in. This week with my blood pressure CrossBraining, I actually had a number of questions. I had asked students what normal range is for blood pressure, how to find patient's maximum inflation level, how to determine the correct cuff size. So it's more than just taking a video. They're able to answer these questions as well, and it's all in one place for me. So again, I had these students do it, and I can spend, you know, a few minutes looking at each student because of the fact that there's that time limit on the video itself. So one thing I want to show is a completed student PPE video. So this is the personal protective equipment. So this is based on her doing her own narration. So you'll notice that it kind of jumps to the next part of the video, but it edits it itself. So it puts all that together. And the students are able to, in each video, edit it as far as just shrinking it down and getting it within that time frame. So I'm going to go ahead and play this so you can see what a finished video looks like.
Gather appropriate PPE, personal protection equipment. Remove any items or lab coat. Wash hands and apply a gown. Make sure to tie the gown securely. Apply mask. Make sure that it is over the top of your nose and pinch the metal strip. Make sure it is fitted over your entire mouth and apply safety glasses. Applying your gloves. Make sure to check for any cuts or holes in the gloves. While applying your gloves, make sure to pull the gloves over the cuff of the gown. This is to ensure no skin is being exposed. Gather appropriate PPE.
So before we get into the Q&A, I did want to just discuss a couple more things about that. So in my program, I have students from right out of high school, 18 years old, to up to 60 years old. And I always find it interesting because I hear colleagues say, you know, that our younger students that are 18, 19, 20, that they grew up with computers. But really, they aren't the ones that did. They're the ones that grew up with cell phones, and they're great with cell phones. But what I found is a lot of those students struggle with Microsoft Word and Excel and just different kind of programs like that. And then on the other end too, I have students who are returning to school, have maybe worked in a factory or been a stay-at-home parent for a number of years and have really no familiarity with either. So struggle with both phones and computers. And what I have found with CrossBraining is that my students don't have any issues. This is one of the few programs I've ever worked with where I don't have any tech issues with it. And if I do have minor tech issues, I can email tech support at CrossBraining and get a response usually within the same day. The students have learned a ton from it. One thing that I like too is that they know that these don't have to be fancy. It's really just getting the skills across. When they do a lot of the skills, they don't even have to have their face, which is great because I know I'm one of those that wouldn't like to have my videos like that. So the other thing too is one of the things that I did when we went to this, you know, we have students that are named practice on other patient or people, students, and they were able to do this from home and use people in their household. So we were able to perform, you know, wound care and bandaging techniques and first aid procedures, such as how to treat a patient with seizures and syncope. So they just used, you know, someone in their household and were able to do it. I even had students using a teddy bear if they had to, because my biggest goal was making sure that they had the skills. And finally, the best thing about this is that once they are done with these, as you saw in the video that I showed, they have a digital portfolio. So they are not only able to put on their resume that they can, you know, perform administration medications or perform lab testing or setting up a sterile field, they now can demonstrate that. So what we're doing in our program is our students are going to be embedding this into their LinkedIn profiles. So employers will be able to see not just that they can do the skills, but see them in action doing those skills. So we're really excited about being able to use that in that aspect as well. So I think that that is all for me. So I will turn it over to the Q&A for any questions that anyone might have.
Thanks, Kristin. I'm Tyler. I'm with CrossBraining. I'll be moderating the Q&A. Along with Kristin, we have, you've already met our founder and CEO, Josh Nichols. We also have one of our developers, Mike O'Connor, who can help answer a lot of the technical side of things. We have quite a few questions already. If you have some, please use Zoom's Q&A feature, and we'll try our best to get them all in the allotted time frame. We also ask, please let us know if you have any additional topics for webinars that you think would be interesting. We know this is a really hard time for everyone, so the more information and lessons learned and best practices that we can share, we would certainly love to do that. So let us know things that are on your mind or other topics that you'd want us to talk about. So the first question comes from Patty, and it's probably for Kristin. What length of time did you give students to develop their skills before asking them to submit the lab skill or the video?
Great question. So really, it's on them. So for example, the way my classes work is when they essentially submit to me, just like if we were in the lab setting, they have 2 attempts at any competency or skill in which they have to get an 85% or higher. So the beauty is that that first one that they submit to me, because of the fact that they've reviewed it, they've done the narrative, they're self-assessing, it's usually very small things that I have to send back and have them fix. So for example, like this past week, a student misspoke and said heart rate instead of respirations. So easy fix. But again, what's nice about this, because they're not sending it to you until they know it's right or they think it's right. I have not had any issues. So I have very, very few that I have to send back. And if I do, they're for minor things, but the skills, it's amazing to me. The students have just done a phenomenal job.
So, our next question is about the other tabs in a lesson summary. I'll turn that one over to Josh, but I'm going to give him a question to get ready because we don't want to accidentally show. We're very careful about FERPA and student information, so we don't want to accidentally show anything that we shouldn't show over a webinar. So if Josh, I guess, or Kristin could just get ready after this question, we'll ask one about sort of the other tabs in the CrossBraining lesson. But for the current question is from Jenna, and it's, have you used this program for demonstrating knowledge rather than a physical skill?
It's interesting. I haven't yet, just because the fact that so much of ours is just skill-based. But what I'm actually looking at doing is I want to start using it, like I said, doing the screen capture. So with the screen capture, then I'm able to do more of that. But on the flip side too, I guess I do in some aspects, because those reflection questions, like I said, are the things that, they have to answer as far as, how do we determine cuff size for blood pressure on a patient, or how do we find their maximum inflation level? So those reflection questions are essentially the knowledge questions that go with that. And what I'm able to do is, and hopefully I don't have any students on here, because what I do is I can put some of those questions on the final exam. So those become a place where I'm kind of relating the skill to the didactic, and then I'm able to put it on the final at the end. And if you know my students, don't tell anybody.
No, students would never try to get an advantage on the final exam. There's nothing to worry about. So the question about looking at the other tabs in a lesson summary, I don't know if Josh or Kristin, if you're ready to screen share. So the question comes from Julie, and she just wants to see, I think, other tabs and steps within the platform and the app itself, and maybe just a quick overview of that.
All right, and I think that my screen just locked up.
Oh, well, that's...
I
can
would be
mark that
more than
down.
happy to,
Go ahead, Josh.
Tyler, you're gonna need to give me some screen, if you could give me the screen sharing
Oh,
capability.
yep. Kristen would have to stop, or did it lock up for you, Kristen?
Yep, I don't think I can. And welcome to Zoom, everyone.
Yep. Try now, Josh. We were doing so well, but whoever had a screen lock up on the Zoom failure bingo, you can put that one down.
That'd be me.
So one of the reasons I built this platform out of necessity. I've been an instructor for over 20 years, and some of the features that I wanted in the platform was one, that they could see a lesson summary so I can type that out. I wanted to be able to put my students in groups if they need be. They could be in groups of one, groups of two, groups of three, but I wanted them to collaborate at times. So now I can make this assignment possible to where all three of them can work together on it, or two of them can work on it. I also wanted to, if I needed to give them different jobs that they could be responsible for. And then at the same time, I wanted to see their status. So I wanted to be able to see who's where, who needs help, how can I help nudge them, and especially online, to just where they can be able, where also they can also see the status of where all the other groups are, and that helps nudge them and motivate them to get started with the lesson. And so if I go back to the lesson assignment, I also wanted to have the feature of being able to give them key terms that they should use in their narration so that they're speaking fluently about the skill set. And then over here with some of those steps, I can minimize these. Oh, I don't want to do that. I can add new steps. And so in here, I can just continue adding steps, adding questions. And so, yeah, there's a number of other small features, but at the same time, we want to at all times try to keep this as simple as possible so that students like Kristin's aren't worrying about how do I use this technology. Kristin, I don't know if you wanted to add to that.
No, I just got my screen back though. so I can take things back if need be.
I guess I can also jump into this side too. So the software, I also wanted to be able to manage my classes. So I wanted to name classes because I have a bunch of different classes. And then down at the bottom, I wanted to be able to organize my lessons, and then so to be able to create lessons to assign into these classes.
Our next question comes from, I just had it up and then the screen share killed it. It comes from, oh, now Zoom's not gonna tell me who it's from. Oh, Nancy, it's from Nancy. How did you overcome the problems that students sometimes have with technology, like doing a video, particularly if they're by themselves and uploading it, or I imagine editing it, and sort of the issues and that arise with that?
So Nancy, what's really interesting, and I'd like to give this one student as an example, and she's great person, very tech challenged. When I had her in the first half of the semester before we got into clinical classes, she was having issues. So we did a one-on-one Zoom. And what I found is she was right clicking at the upper right-hand corner of her mouse pad instead of the lower right. So she really struggled. She was one of my students who turned in beautiful videos and had no issues. So this is what's, I think, kind of the coolest thing about CrossBraining is that they can record it from their computer. So if they set their laptop up, they can record it directly from the laptop. And that's what most of the students did, is they just recorded it themselves from their laptop. And as far as editing it, CrossBraining really does it for you. It's just a bar that you move, and you don't have to have really any tech skills at all to be able to do this. And I mean, it's just, like I said, none of my students had any issues. And I know it's hard to believe because almost every single product you use, students have an issue. Now, I will say they had issues with everything else that we've done this semester, but this was the one thing that they got it done. And I was like, wow, that's awesome. It's just very user friendly.
Mike, you might want to field this one, but it is directed directly at Kristin. We have two questions on LMS systems. Shelly and Patty have both asked, Kristin, do you use an LMS system at your school, and whether or not CrossBraining integrates with it?
We do. We use Moodle. I haven't even asked because the fact that Moodle, if anyone's ever used it, Moodle doesn't like a lot of things. But I know that it does with some. So Mike, I'm going to turn over to you.
Yeah, so I run our product roadmap, and our development team right now is working on our next release, which is scheduled for January, ideally over the Christmas break. And that will support single sign-on with any LMS solution that supports the tech standards for single sign-on. And then later through the year, we're going to be working on rostering and the other features that come along with that LMS integration.
The next question is from Jenna, and she says, is there a limit to how many steps you can include in a lesson? And then she asks a clarifying question is, does each step get a 45-second video, or is the entire video 45 seconds? Kristin, you want to field that one?
Yep. So Jenna, one thing that, like I said, that I did is separate things out. So really it's 45 seconds for a lesson. So like the video that I just showed you with the PPE, that was one 45-second lesson. So again, what I've done with things that may take longer is I chunk it. So, the first part being, withdrawing medication from a vial. So that's one lesson. The next lesson would be, administering the medication. One example, one that I split into two, is our wound care. So I have setting up a sterile field for performing wound care. So that's one 45-second lesson. And then the other part of it is actually performing the wound care on the patient. So that's the other 45-second. I don't know if there's a limit to the number of steps because I haven't reached one yet. But I think the most steps I've done is about 5. But again, my thing is I don't want to totally walk students, handhold them as they do these. So even with my other assignment that I have where they're removing PPE, the only thing I have for steps is remove first item, remove second item, remove third item, remove fourth item, because I want them to learn the proper order. So they have to determine what that is and then perform it. So I try not to give them a ton of hints, I guess I would say, but obviously you can put as much in there or as little as you want to. And I don't know if Mike or Tyler, if you can answer about the number of steps. Is there a limit on that, or?
There is no hard limit. Practically, there's only so many steps you can really squeeze in and have the students really demonstrate something useful. I do believe the most I've ever seen, was it 12 or 18 steps, Josh, of the one lesson you did over the summer? But yeah, there's not a hard limit on that. And I did see Shelly, you asked about D2L. They do support the integration standard. And so that should, all of the common ones, Canvas, D2L, Moodle, I think 97% of the market all supports the same single sign-on and rostering standard.
This next question is one that I think is on everyone's mind, and it's from Dee, and she says, did you lose students because they could not learn in an online environment?
Yeah, good question. I think that we've all lost students. But fortunately, most of my students lost were the ones in my prereq, like medical terminology, intro to body systems. But once I got them in the program, um, I didn't find, I guess the students that I've lost, it wasn't because of an inability to learn online. Um, and I know some of you can relate to this. I think those students would have been gone regardless. So the ones that I have lost, I wasn't surprised. But the students being online, even they've done extremely well. And I use a mix of things. So I use the CrossBraining for a lot of their skills. I use SimTix as well. We use MindTap with our text. So we're using a lot of different things. And it seems to be working really well for the students. And like I said, my one group was pretty much online for almost their entire program. And they're in externship now and they're doing great. So
this question is interesting, and I'm kind of curious about the answer. It's from Farah in California, and she wants to know, did you or anyone use the student videos for like marketing or recruitment purposes?
not yet. But that is definitely something that I want to look at. And it's just a matter of putting on our website. Like I said, the bigger thing is I want the students to be able to market themselves, for employment and all of that. So, they do use it in that aspect. And we're kind of limited with our marketing as far as the marketing that's done. So our college, kind of being a community college, they market more for the college as a whole, and not so much for individual programs. So the most marketing I would be able to do would be, putting a video on our website. So, which I haven't done yet, but I'm going to do that. Thank you. It's a good idea.
And our last question, and we'll let you all get back to your day, is Frank from Philadelphia, and he asks, how did you handle students who were uncomfortable in front of a camera? Not maybe for tech issues. I think this question is more getting at, they have a personal discomfort with being in front of a camera, or my camera's not on, so I don't know how much I can talk. How'd you handle that, Kristin?
No, and that's a great question, because as I mentioned, I'm one too that does not like videos much. I don't even have my own picture on my Facebook page. So I totally relate to that and empathize with the students who are concerned about that. Besides this PPE video, really all of the other ones that they've done, they've been able to do without having their face in it. And that's what's really cool about CrossBraining, is when you're really just getting at the skill. And that's what I tell the students, you just angle the video so it's just showing your hands. So it's just showing what you're doing. So like we've done the hand washing, wrapping an instrument for sterilization, the pulse, respirations, blood pressure, and all of those, the students' faces aren't in the video. So they found a good way to do that. And really none of the students have, complained about it. They've, run with it. And I know for a fact that a lot of students I have right now are not video people. They don't like it because every time we have a Zoom meeting, they don't have their video on. But they've done the videos and done well with it. But they also know that it's just me looking at it, and I'm not going to share that video without their permission. So, that's the big thing too, is they, even with this student that we showed today, she had to sign a release, and, I made sure that she was okay with us showing it. So, I think when it's one-on-one, and once they know that they can do these checkoffs, essentially from home without me standing watching them, that's usually a big seller. They think that's, it's just a lot more relaxing to them if they can get a video instead of me staring at them watching them do it. They're usually all for that.
So that's I believe all we have for questions. Josh, do you want to wrap us up?
Yes. Thank you everyone for attending today. We know that everyone has a lot to do, so we wanted to let everyone know that if you want to adopt CrossBraining for next semester, we are able to provide whatever assistance is needed to make that happen for you. For those interested, visit www.crossbraining.com/winter 2021. Thank you everyone and enjoy the rest of your week. And thank you, Dr. Spencer, for helping us out and sharing your experience with how you handled remote learning in the spring of 2020.
Thank you. Thank you, everybody.